This video is going to show you how to put the circuit on and do the pre-use test for the Puritan Bennett 840 ventilator. The first thing we want to do is put our filters in line. This is the expiratory filter for the Puritan Bennett 840. It is made specifically for this ventilator. It slides into a little track here, and then you push the lever down and that locks it in place. Up is unlocked, down is locked. You then have to put a filter on the inspiratory side, which is from the ventilator to the patient. This is the filter that is made for the Puritan Bennett 840. Unfortunately, one of our students got a little zealous, and you can see that crack. Due to that crack, this filter leaks and it will not pass the pre-use tests. So if this were to happen in a hospital and you cracked it, you would have to redo the pre-use test and get a new filter. So we're going to substitute with another filter that for our purposes for training will work just as well. You want to push it straight in and not down. So as I said, when you push it on, you push it straight in. I think the student that got zealous pushed it in and maybe did a little downward pressure, which then cracked that filter. So now we're ready to do our pre-use test. Actually, we're not. We're going to connect our circuit. I'm going to connect the inspiratory side. How do I know? There's a temperature probe port, and also if I follow it up, the temperature probe port is at the patient Y also. So this is my inspiratory side, and here is my expiratory side. And I seat that on just like that. I will then turn on the 840. You lift up the door and turn it on. It'll go through a small self-test. And it's hard to read, but you see the two boxes on here. There's one dark, one light. It says same patient and new patient, or new patient, same patient. I'm supposed to have another box down here that says to do the SST. Well, the Puritan Bennett 840, if you turn it on with the Y blocked, it will think that it's going on back onto a patient and will not allow you to do the SST. So you must turn it back off, unblock the Y. I'm going to lay this to the side, and then turn the ventilator back on. The circuit will not be pressurized, and the ventilator will then allow you to do the pre-use test. You see the last box down here? I will show it to you better in just a second. Now, when I press this box, I have about 10 seconds to press a button on the side, which is right here behind the power cord. This says test, T-E-S-T. So when you're in lab, look at it. So once you turn on the Puritan Bennett 840, you then press this button, and you have 10 seconds to press the button on the side. So I'm going to reposition the camera to get you a little better view. There. You see how it says SST? I am then going to press that, and then come down here and press on the side. I'm now into my test mode. What type of patient am I going to have? I'm going to have an adult. If I wish to change it, I could change it with the dial. We're going to stick with adult. Whenever I'm happy with my choices, I just hit accept. We have a heated expiratory tube, yes, and I'm happy with all that, and the humidifier size is the appropriate size. I'm going to hit accept. Please wait. And then you practically read the directions on the front. Connect the circuit with inspiratory filter and without humidifier. I did that. Block the Y. I'm going to retake my cap and reblock my Y. Now, whenever you're doing these pre-use tests, do not hook it to a humidifier. You will not pass the test. These humidifiers will leak because you're not plugged up to water. Once I block my Y, I hit accept. This is just a waiting game, and the machine will prompt you through every step. The servo Y does the same thing. All of them will prompt you, and you basically read the screen. Okay, it says to connect humidifier if applicable. We have already connected it. This would be if you have an HME that you want to put in line. Ours have a twist, so they tend to leak. So we're just going to accept that our HME is already in line. Okay, it's doing the circuit test. As you can see here, it's holding pressure. There. So then the next item is disconnect from patient port. So that is my exhalation filter. So I'm disconnecting the expiratory side. Right here, I disconnected it from the filter and I hit accept. Then it tells me to reconnect it. Connect from patient port. I hit accept. Then it says to unblock Y. So I'll unblock my Y and hit accept. Then it says block Y. So I'll put the elbow back in, hit accept. Then it says, if what is water in humidifier? No, it's not, so I'm going to hit clear. If I hit accept, that says water's in there. If I hit clear, that means no water is in the humidifier. Now it's testing for tubing compliance. Tubing compliance is how much stretch your ventilator circuit has. If you do not compensate for the stretch, you will be giving your patient less volume than what you think you will be giving them. So if you have a 10 cc stretch in the tubing and the patient is supposed to be receiving 500 cc's or 500 milliliters, then the patient would only be getting 490. By the machine knowing how much stretch is in the tubing, it adds that volume in automatically. It is now telling me to unblock the Y. I did. Then it says, when done, press accept. And now I can press exit SST. And I hit accept. It takes me out. Does another quick pre-test, self-test. And now it is ready for me to hook up or do my setup for my patient. That is the pre-use test. With the Puritan Bennett 840, you can actually turn this off after the pre-use test and it will save it in here. Other ventilators you have to leave on standby or else it will delete the pre-use test, such as the Servo-I. That is the pre-use test for the Puritan Bennett 840 and circuit setup.